Hello everyone, I'm Sarah Strackhouse with Real News Communications Network, and we're talking to Dr. Johnson today and live with Dr. J. How are you?
I'm excellent, thank you.
Good. So it's fall and we're all kind of feeling the sniffles probably. I feel like I've lost my voice a little bit. Can you tell us what people right now are probably feeling?
Well, they're feeling exactly what you are. With fall pollens, ragweed is one of the big ones. And those people who are sensitive to ragweed then get congestion, hoarseness, and then you can get secondary infections. The allergy flares up your mucous membranes enough, and the defense mechanism doesn't work well, and so you get a secondary infection. So if the runny nose turns green or yellow, then you need to get some help, particularly if you have fever and chills along with it. So
if something turns into a sinus infection, is that kind of a little bit what you're talking about?
Yeah, exactly.
Okay.
So the mucous membranes in your sinuses get inflamed, they retain bacteria, and then you get that secondary infection. The same thing happens with the flu.
That was going to be my next question. I feel like it's flu season right now. We're all kind of dealing with this. How can you tell the difference?
You can do it by culture. Usually, if you have a bacterial infection, your white cell count goes up, but not always. If you have the flu, sometimes the white cell count goes down. And so if you do have the flu, get on some medicine like Tamiflu or one of those. And then you may, if you aren't getting better, may have to be treated with antibiotics.
I see. Okay, so if people think they have allergies, they're kind of getting that cough, that nose, that all those feelings, what are some of the steps that they should be taking to get that remedied?
Well, if you have allergies, it makes sense to get the allergies treated so that you don't have the problem year after year. And so the treatment is with allergy immunotherapy, where you take allergy shots on a routine basis to help build up your blocking antibodies. And then that calms down your symptoms, and you aren't sick with that. I'm hoarse today because I got the flu and the cough a week ago. And it comes back
a little bit.
A
Well, so can you also talk to people a little bit about what the process is like? You were saying kind of getting that shot. So is it something you have to then get administered every week or something like that?
Well, here at Johnson Medical, we test you in a fashion that you can take your shots at home. And so you don't have to come in once a week, typically, as the typical allergist has you. And we have people use the shots every 4 days. You can, during allergy season, increase that to every other day if you need to. And we talk about that when you come in for your testing and for your treatment. To get you on the right schedule specifically for you. And what about for people who are, besides not rolling in the grass, what should people be doing to make sure they're staying away from getting as many allergens, coming into contact with them as possible? Well, anytime you're allergic, it makes sense to avoid it. And so whether it's food or whether it's pollen, so if it's high ragweed season and you have fall pollens, it makes sense to stay indoors, keep the air conditioner on, have good air filters on your furnace or supplemental air filters. And if you're going to exercise indoors instead of outdoors. Don't ride with your windows open in the car, turn it on, recirculate. And those are all things that you can do to avoid additional exposures, which can flare you up.
So really common sense.
Common sense, but a lot of people don't even think about it.
I mean, I probably wouldn't have thought about the thing riding with the windows down. I do that all the time.
Exactly. Until you get sick, and then you decide, hey, maybe I got too much pollen exposure.
All right. Well, I won't hold you too much longer because I know you're kind of trying to cough through this, but is there anything else that you really want people to know when it comes to fall allergens and making sure that you're as healthy as you possibly can be?
Well, if you aren't clearing up, then sometimes you have to be treated like with the antihistamines or with steroids, get a steroid shot. You don't want to do that too much because it can be detrimental to your system. But to get you through, to get it calmed down, that's a measure that can be taken to help you feel better on a more immediate basis.
Absolutely. And if people are just kind of watching for the first time and might not know that much about your practice, can you talk a little bit about your focus and what you do?
Yeah, here at Johnson Medical, we look at underlying causes. People that have chronic conditions, it's many times they don't respond well to medicines. Medicines don't help. So you have to look at what's the trigger factors. And sometimes it can be foods that trigger an allergic response. You have no idea that's what's doing it, whether it's fatigue or irritability, memory problems. It can be chemicals. It can be mold in your environment, live in a damp, moldy environment. Or it can be toxins that you've been exposed to either in the workplace or at home inadvertently. So our whole goal is to find what's the underlying situation, make sure that we have a good history, look at what's happened throughout your life, and then decide what is the best way to actually treat you. And of course, if it's something you're allergic to, avoidance is the main thing, and not, then we design a specific treatment to take care of whatever it is that is triggering the symptoms.
Getting down to the bottom of it.
Exactly.
Oh, perfect. Well, if people have questions, what's the best way to contact you?
You can call my office at 972-479-0400. Look at our website, johnsonmedicalassociates.com, or there's the Hyperbaric website, which is Hyperbaric Centers of Texas, and they talk to each other.
Perfect. And of course, we do have Johnson Medical Associates tagged up in the top of this post. Is there anything else you want to leave people with?
I think this, pay attention to what's around you. If there's something that bothers you, find out what it is and avoid it. When you are allergic, irritants can cause more symptoms. So like plug-ins, scented candles, bounce, in your...
All the stuff that smells good.
Yeah, all that stuff irritates those mucous membranes. So you may want to clean up the house a little bit from the smelly stuff.
All right. Well, that's good advice. I guess I'll have to do that at my house. All right, Dr. Johnson, thank you.
Thank you.
All righty. Bye-bye.